Hey there, welcome back. This is Dr. Schmidt. I am day 5 post rotator cuff surgery. Just to recap my injury, I had a full, this is actually my MRI. I had a full tear of my supraspinatus tendon, which is attached to the supraspinatus muscle, one of the main rotator cuff muscles. So as you can see, this is actually a complete tear here with some fluid showing up on MRI. And while they were in there, you can't see it on here, but they had shaved down my clavicle and they opened up some space and did a subacromial decompression on there. So I didn't make a video for the last couple days because it felt more or less the same since my last video was post-op day 2. I had the surgery on a Monday. This is Saturday, so I'm post-op day 5. And my pain is less for sure. I've cut way back on the medications and the pain meds. Right now I'm taking 2-Aleve when I wake up, 2-Aleve when I go to bed, and I'm taking still 1 Norco with bed, and I'm taking 1 Norco when I wake up. But the pain probably overall, as I sit here right now, it's about a 2 out of 10. When I move around, it spikes up a bit though. When I get jostled and bumped around, it jumps up, but then it settles back down pretty easily. So yesterday we took off the dressing for my incisions. So I want to show you a couple things, and I'll mention this shirt later too. I talked about it before. I've got an ice pack on here, but we took the dressing off my incisions. So I've got a fair amount of bruising that starts to develop. It's going to be worse. I don't know if you can pick it up on camera right now. It's going to get worse over the next several days. But I had 4 incisions, 2 across the front, 1 in the side, and 1 in the posterior aspect in the back of my shoulder, where they actually put the camera in because I had arthroscopic surgery. So 4 incisions, about 1 inch to 1.5 inches long now. They're healing very well. Something I'm going to talk about a lot of things today because I took a couple days off, but one of the things to mention is when you do take your dressings off, take a good look at the incisions. Make sure they're not red. You don't want to see any pus coming out of them. A little bit of blood is normal, but if you see too much of it, and especially if it looks red and it's inflamed, get a hold of your doctor. So the incisions are off, which allowed me the opportunity to take a shower, which was fantastic. This is the first shower I've had since the surgery, since before the surgery, actually on Monday morning. I did need help with my wife the entire time. It's still difficult to move around, certainly difficult to manipulate the shoulder, but I'm going to show you some tricks that I picked up in the shower, and it worked. So I have, if you don't have one already, this is just a cheap sling. You can get this from CVS, Walgreens, Walmart. You may get one when you initially go in to see the doctor. So I took off this brace, and I'll talk a little bit more about this particular model in a minute. I took off this brace and I substituted it in the shower with this sling. And it gave me the chance to still be supported in case anything happened. I didn't want my arm to slip. So I still had a little bit of support, lessened the danger of re-tearing after the surgery, but I didn't damage the brace. I didn't get it wet, and I was able to keep it neat and clean. So in the shower, I went ahead and I used this brace and just washed up, was able to wash my hair with a little bit of help. And getting underneath this arm, what I found is if you are able to slowly lower the arm to basically up and down natural hanging position, and if you slowly lean, it opens up some space. The angle that you create opens up some space so you can wash under your arm, and it felt wonderful. It was just really helpful to me. It made me feel a whole lot better about life in general. So right now it's all about comfort. Many of the things that I was having problems with before are fully resolved. I was having problems with the nausea. That's gone. I haven't taken a Zofran in about 24 hours now. I was having problems with heartburn because I was intubated during the surgery. All that's gone as well. So now it's all about comfort. One of the interesting things is I've been sitting a lot in my office chair because it has these movable arms, and I can adjust it to the proper height, and it actually takes a little bit of load off, frees up some of the load, the strap around my neck, and it feels great. And I had mentioned this shirt also, and I think we got this from Med Rehab online. I want to say it was about $40. This has been fantastic. This shirt allows me to, I can peel it back while leaving the shirt on, put my ice pack on, and then I can fold it back up and cover it up, and it kind of holds the ice pack in place once I snap this in to position without falling. This shirt, I think we bought it 1 or 2 sizes too big, and you can actually pull it up from the bottom up and just kind of slide one arm through, and then you just pull the waistband off a little bit and snap it up, and it's great. So this immobilizer is a very common immobilizer. You probably will get something very similar to it. I believe this is called the Breg Arc 2.0 is the name brand, and I'm going to include the link to that on this video. They have some good instructional videos on how to use the brace, what to do with the brace, what not to do with the brace, and how to get in and out of it properly. It's pretty simple. Just sort of snaps in together. You can stick your thumb through, and I'm still a little bit slow with it, but a little bit of work, I can get it back together myself. There's one on the waist as well, and of course there's this aluminum bracket here that keeps your arm away from your body. So with all that in mind, my comfort level is much improved over the last several days. So I tried to get out and about of the house a little bit. I did today. We went and walked about a block or so, and I went and got some tea. My wife had some coffee, so it was nice to get out of the house. Driving is still an issue. I can't drive right now. It's simply too difficult, particularly because it's on my left side. Trying to get it out with the driver's side door there is kind of tough. So, and the bumps in the vehicle still cause me a little bit of alarm, but it's definitely better than it was a couple days ago. So I think at this point, you probably could be a passenger in a car driving around. Of course, if you're on pain meds, please don't drive in just an unsafe condition. So everything seems to be going really well. One more thing I did want to mention in this video, though, is pets also, and it's something that I didn't think of until it happened. I have 2 dogs, one very large dog who's very concerned and interested in my shoulder. So make sure that you get some help with that. You know, the bigger dogs, sometimes they don't realize their size. If they bump you, they can be a problem. Of course, he likes to sleep in the bed with us, so you know he's trying to jump in and visit me and sniff my arm, but it's difficult to fight him off, so make sure you get some help with it. But journey's going well. I'll keep you posted. I am going on Monday to have my incisions removed and a follow-up with my orthopedic surgeon. I'll keep you posted then. Thanks.